So we talked earlier about the Amazon, Berkshire Hathaway, Chase, and maybe that's what they do. Maybe they figure out how do you replicate the things that work, like a Geisinger. But in prior conversations today, we've talked about what are the things that are needed to be successful, and you need scale, and you need membership, and you need diversification, and you need these things, and yet we have a system, the VA, that has all those pieces. And at times it's been touted at one time as one of the earliest and best for its IT and interoperability aspects, and now it's fallen on hard times, let's say. Given its size and the cost structure, is the VA problem? Is it fixable? Is it a lack of funding? Is it management? Is it the failure of government sector trying to manage something which could be better managed in private sector? I'm curious,
yes.
Check.
Right.
So kind of thoughts on what happens to the VA. It's serving such a difficult and needy population, and I don't see that population necessarily being better served currently in the private sector world.
So I think part of the conversation, it's such a hot potato politically. As soon as you start talking about anybody who talks about privatization of all or part of the VA, it becomes a very emotional conversation. My experience at the VA has been there are some things that they do exceptionally well, and there are some things that they do rather poorly. And I wonder if it's possible to take an objective look and say, how do we best serve that population, and what are the things that we should keep whole in the organization, which is probably things like primary care, mental health, things that are unique to the veteran population, and what are the things that should be contracted out or with a Medicare type card or something like that for high acuity things like cardiovascular surgery and neurosurgery and that, and maybe that's the answer. I don't know.
Although, where would our physicians in training be trained if it weren't for the VA?
Well, we can continue to train the primary care docs and the psychiatrists.
I think, Mark, you guys worked in VAs just like I did, and I think a big part of the problem the VA is experiencing now is a reflection of the fact that the patients that they serve have changed. They are not the World War II and Korean War veterans that accumulated traditional chronic medical illnesses. Now we have the Vietnam War and now the Gulf War veterans who have a different spectrum of medical problems. I remember distinctly, I trained in Philadelphia, and there was an outstanding spinal cord unit. I mean, it was the best in the world. And the Philadelphia VA would send their spinal cord patients there for care. They have some profound strengths. Their IT platform has often been singled out as being good. It's interoperable, and it's comprehensive. They're building a personalized medicine program that I think could be potentially just dynamite. They have the ability to have enterprise level direction to the projects that they wish to undertake, which, frankly, working at Aetna, I longed for many a day. There are things that they do and they do well, but I think they haven't adapted to the patients that they need to serve. And there's a certain, I hate to say it this way, but mentality about the way people do things in government institutions like that are not necessarily consumer friendly or patient focused, and that needs to change for them to really come to the leading edge of healthcare delivery. It's not unfixable. It is fixable, I think, really, but I think they have a serious problem right now.